Where you place it will kind of help determine which injury you're going to treat for. The first one is patellar tendonitis, jumper's knee, okay, Osgood-Schlatter's, all that stuff's all kind of related. If you can put a fulcrum in here and change the point of pull, okay, so we're going to put something here, it takes the stress out of my attachment site. Now I'm pulling from here. It alleviates a lot of patellar tendonitis, or especially this Osgood-Schlatter's that happens right here on the tuberosity. Okay, if I put my strap here, that's what I'm going after. Sometimes we have, have you heard of patellofemoral syndrome? Has anybody heard of that? This is where your patella stops riding in the groove and is pulled off because of a muscle imbalance and starts grinding. Okay? Almost always it's because this muscle is weak, these muscles are stronger, and it pulls it in this direction.
So it rubs against the femur?
So it rubs against that condyle on this lateral side, and a lot of times they'll complain of pain on the outside of their patella. Okay, sometimes it'll even be on the inside. If you can support that so that it can't slide, then it'll ride more in its natural groove. So if we put this tape job here and go across the patella to hold it down, now we've corrected a patellofemoral problem. Okay. For our class, I'm going to want to see the patella tendon problem. Okay. The best way you're going to do this, you're going to spray this down real good. Then you're going to roll yourself a little cigarette. Sticky side out. Okay. So we're going to roll this in. Again, it's about 6 to 8 inches worth of your tape. Okay. About the size of the joint, right? Okay. Now we need to find the middle of the tendon. We need to be halfway between the tuberosity and the apex of the patella. So we're going to find that midpoint, and that's where my strap is going to go. Okay. Now, can you see how her skin moves? Okay. Everybody's skin moves a little bit different. Some of us are really tight in our skin, and others of us have really loose skin. That makes a difference on where I place this, because when I pull, I'm going to go lateral to medial, and I'm going to pull this across. When it tacks down, it needs to be in the middle of the patella. If it's like over here, it's not putting any pressure on that tendon, right? If it's all cockeyed, it's not going to do it either. So as you're placing this, mess around with it just a little bit. That's probably about where I'm going to need to be. So then we're going to do 4 strips. First one's going to go, we're going condyle to condyle. Okay? Kind of the back edge of that condyle. Yeah, tibial condyles. Stay. You mess around with it too much, you rub all this sticky off. Okay? Now, the first strip is going to go right over the top of it, the condyle, and my next one is going to go just above it. And then I'm going to go below it. And then I'm going to go right over the top of it again. And that's it.
So you can buy braces that basically do the same thing, right?
So yeah, you've all seen
those black.
You've all seen people wearing those black things.
I own one.
That's the way to get around having to tape it.
Yeah.
Okay, but on the inside of that black thing is a piece of tubing, just like this. Okay, a little piece of plastic that puts pressure, so when they pull that down, it puts that pressure on there. Okay, this is always done with strap tape. This is gonna, it has to stick really well because you're doing this constantly, right? So we're going to put down the cover roll first, then we're going to use our brown heavy strap tape to put it on. Sometimes this does peel off, and sometimes we'll have to go around it really lightly with the stretch tape. But if you go around the whole knee with white tape, it'll cut off circulation pretty quick.